Traditional range of motion assessment is done in a predictable mechanical manner. The practitioner assesses the flexibility of joints and muscles by feeling for structural restrictions at endpoints of linear movements that either stop the movement or cause pain. FST range of motion assessment is done slowly, gently, and pain-free according to the tolerance of the client or patient. Unlike traditional stretching, the FST practitioner supports the client by hugging them close to their body during every stretch so that the client feels safe, allowing their body to be more effectively stretched without pain. The practitioner assesses the flexibility of the joints and neuromyofascia not only for restrictions to circular, diagonal, and other three-dimensional movement, but also for specific quality of tissue response for a more comprehensive assessment.